So as you can see, this patient, left side of the face is completely necrosed. You can see the dead skin over there. That's the skin which is dying, and that is completely necrosed. And that's the patient's left eye, and you can see the eyeball is swollen. The eyeball, the fungus has completely invaded the patient's left side eye. The patient has no vision in the left eye. The patient is completely blind from this particular eye, and you can see there's a lot of blood vessels on the patient's eye surface in the sclera, the white part of the eyeball, and the cornea is also completely almost opaque. Now this patient's eye is completely been invaded by the fungus, and this all happened under just 10 days. And that's the patient's left nose, and you can see that's a lot of fungus which is causing collection in the nose. And that's the patient's right side. The patient's right side is somewhat healthy, but you can see there's a lot of secretions on the patient's right side as well. Now the patient's left side face, left side eye, and the left side nose, along with the entire skull base and the sinus, is actually dying. And you can see that's all the fungus and the necrosed material, which you can see I'm removing right now. And that's the skin also which is getting affected. So it's become very much cheesy, soft leather type of discharge inside. You can see all that is fungus and dead tissue. That is what I'm removing right now. That's all the pus inside. So this is a nose which is completely looking like a mess inside. I will have to remove all the dead tissue from within. Step by step, I'm going to show you what structures are affected and how I'll be removing each and every structure. You can see all that gooey material, all the boogers inside. I'm going to show you the patient's hard palate. I'm going to open the patient's mouth, and I'm going to show you the dying palate as well. You can see that's a reddish, purplish black discoloration of the hard palate. That bone is also actually undergoing necrosis. Basically, in simple terms, this bone is also dying. So the patient's left side is almost completely involved, along with the eyesight as well. So we may have to remove this patient's entire half left side palate. Whatever dead tissue is there in the sinus, the skull base, the nose, everything is gonna come out. I'm gonna remove everything. So what you can see me here doing is I'm using the debrider machine here. And this is a machine which actually cuts and sucks out all the tissues inside. So that's a major part which I'm trying to cut. That's the middle turbinate. It's completely necrosed, as you can see. It's completely necrosed. And you can see there's the blood which is wine colored. The red wine which we have, it's almost port wine colored bleeding over here. That's affected by the fungus. So the fungus, this fungus is basically the black fungus which we normally know it as the black fungus. That is the mucormycosis, highly aggressive fungus. Now this happens in patients who have a very high sugar levels in the body, uncontrolled diabetes, and the fungus invades such tissues, completely blocks the blood vessels, completely makes it bloodless, and that is how the tissues start dying off. That's the middle turbinate. You can see I've removed. That's completely necrosed. You can see partly having a little blood supply, but that is definitely diseased. So that is out. We're going to send that for culture. So this patient within 10 days developed loss of vision, necrosis of the skin on the outside part, as you can see on the video over here. And the patient does not have any sensation on the left side cheek because all the nerves are also dead, affected by the fungus. So I removed the middle turbinate, acquired some space here in the nose, and what I'm doing right now is opening up the ethmoid sinuses to create more space. So I'm going to flush the entire sinus area, remove all the sinuses, open up the sinuses, expose the skull base area, because this patient's brain is also affected in the left side temporal lobe. I'm going to show you all that. So the infection has spread from the nose into the tissues in the sinus and the nose, and have entered in the skull base and have somehow gained access to the patient's brain surface, that is a temporal lobe, and the patient is having issues such as patient is not fully conscious oriented. The patient is able to understand what you're asking, but then the patient is somewhat uh, drowsy. The patient is not completely oriented because of the affection of because the brain part is affected. That's all that dead tissue I'm removing right now, making space inside. So whatever tissue you're seeing right now is all been affected by the fungus very acutely within a week or 10 days period. It is that fast. So you really have to be careful. Seek medical emergency as soon as possible. That's all the dead tissue out there. You can see all that whitish debris. That is all the fungus inside that dead tissue. So whatever bleeding you can see here, there should be a minimal bleed because not all the blood vessels are dead. Some healthy tissue is still there. Now that's the skull base up there. You can see some minute blood vessels. That's the area of the patient's brain. And what I'm removing right now is the sinus bone. That's the sinus bone which I'm removing right now. So, and that's the diseased tissue up there which covers up the sinus area. So I'm still in the ethmoid region. So you got to be really careful not to injure that skull base bone which separates the brain from the sinus, because if you cause an accidental injury in the brain, the patient is going to have a CSF leak and all the fungus will have a direct entry into the patient's brain and the patient may die as well. That's the brain of the patient, you can see very clearly, and that's the eyeball of the patient where my instrument is. So the eyeball, the brain, can be easily accessed through the nose within. So that is why the surgery of sinus surgery is of real importance, because one wrong step and you can enter in the patient's brain and the eye in a normal situation. That's the patient's maxillary sinus where I'm in right now, the huge opening which you can see. So everything is affected and all that dead tissue I'm going to remove. So that's the skull base area up there. So I'm just taking off all that bony remnant. That's the eyeball of the patient. So later on, once I've removed the entire dead tissue here in the nasal cavity and the sinus area, I'm going to completely show you the skull base area where you can actually see the brain of the patient through the bone. And also I'm going to show you the patient's eyeball, because I'm going to literally open the patient's eye from within the nose inside. So I'm going to show you the optic nerve, the eyeball muscles from within the nose inside. So that's the skull base up there. You can see the skull base is basically the bone which separates the brain from the sinus area. So if there's an injury in the skull base, the brain layer called as the meningeal layer, the dura, will prolapse in the nose. That's the brain at your 12 o'clock. As you can see, a lot of tiny blood vessels running along. The bone is so thinned out, you can actually see the gyrus of the patient's brain. That's the patient's brain. So if I injure that bone, the brain is definitely going to be popping out in the patient's nose. So you really got to be very careful here, because if the bone is already affected by the fungus, and that's the anterior ethmoidal artery up there. You can see from where the bleeding is happening right now, minimal ooze. That's the horizontal anterior ethmoidal artery that runs along the skull base. That's the artery where my suction is, the anterior ethmoidal artery going from the eyeball, that's the eyeball area, and going alongside horizontally into the where my suction is right now is the brain cribriform area. So anything above that is brain. So you've got to be really careful. And you can see the bone is completely affected by the fungus. You can see a lot of white spots. That is the fungus affecting the bone, and that is all skull base. If I poke my suction through and through, I'll be actually touching the patient's brain. So this is how in a long-standing infection the fungus somehow destroys the bone and enters access to the brain. Now you can see slowly the space is improving inside, and you can see all that dead tissue, which is normally reddish pink in color, is now turned as black, gray, and purple in color. You can see it's all dead necrotic tissue. So I'm going to remove a very huge tissue right now. You can see that's a very big, massive amount of dead tissue I've removed from the patient's maxillary sinus. That's the dead tissue. You can see how purplish, blackish the tissue is. That's a huge dead tissue layer. And that is going to be sent to histopathology examination to know what kind of fungus we're dealing with exactly here. So that's been collected and that's going to be sent for examination. You can see all this dead tissue I'll be removing out. So I'll be taking out the entire maxillary bone. Now what you can see, that's the bone there. Now imagine you're seeing a person in front of you, and just besides the nose, the cheekbone, which you can feel with your finger right now, what you can see on the screen is exactly that cheekbone which I've gained access to from the nose. And what you can see at my suction is the nerve that is going in the bone. It is basically coming outside from the bone within through a hole inside. You can see that's whatever bone you can see on the screen right now is the cheekbone, the one which you can feel with your finger on the front of your cheek area. This is what you're seeing right now on the screen. And that you can see that's a hole up there. That's a huge nerve. And you can see a lot of white spots on that nerve. Those white spots, tiny spots, are the fungus, the spots of fungus basically trying to invade the nerve. And that is the reason why the patient does not have any sensation on the cheek, because that's the nerve that gives you sensation on the cheek. Now, after drilling that cheekbone, that's the huge cheekbone that I've removed from the nose. It's pretty huge, so it's difficult for me to take it out from the patient's nose right now. Somehow trying to manipulate that. So all this bone is also necrosed. Basically, you can say it's a dying bone. So if you keep the infection inside, do not treat the patient, do not operate on the patient is going to definitely die. The patient will die if you do not operate on this particular patient. Do not remove all the dead tissue from the fungus tissue. You can see that's a huge bone that has been taken out. That is all necrotic infected bone. You can see a lot of whitish, yellowish spots on the bone. I'm going to show you. I'm going to hold the bone right now. You can see multiple yellowish black spots. That is fungus actually invading the bone inside and killing the bone. That is how the bone dies. So it devoids the bone of any kind of blood supply, and that is how the bone dies. You can see deep inside now, we've opened much of the space inside. So if you rewind the surgical video, you can see there was hardly any space to go in the nose, but now you can see that's a huge opening we have gained. And that is how we're removing all that dead tissue. Another dead tissue out. Now you can see another hole inside. That's another hole inside. And you can see a vessel that is coming out of that hole. The hole in medical terms is called as the foramen. And that's the foramen called as the spinopalatine canal. And that's the spinopalatine artery. You can see that's a huge artery coming out of that hole. And that is completely a dead vessel. There is no blood in that blood vessel. So now what you can see on the screen, I am in the patient's frontal sinus area. The frontal sinus is a sinus which is present above the eyebrow, which is the forehead basically. So I'm basically in the patient's forehead right now and trying to remove all that bone and the fungal infection inside. So from the nose, I'm going in the patient's forehead, frontal sinus, and trying to take off all that dead tissue. You can see a huge block of fungus up there, yellowish black fungus. That's the fungus. That's the frontal sinus opening from within. And I'm going to suck all that fungus out, open up the sinus and examine the sinus from within. You can see I've sucked the entire fungus out, and that's the opening of the frontal sinus, which is very huge right now. And what you can see, that's a huge cavity inside. That's the whole frontal sinus of the patient. And what bulge you could see is the patient's brain within the sinus posterior wall. So I'm going to give a flush, a fluid wash. This fluid wash consists of the antifungal injection called as the amphotericin B, which is the main choice of drug in this situation, which kills the fungus rapidly. You can see I'm going to take off all that dead tissue here. So everything, whatever you see here is going to come out. Nothing is to be spared here. This is all the dead bone, dead tissue, all infected with fungus. So remember, this happens because of the high sugar levels in the body. Beyond 400, beyond 500. So I'm going to open up all that bony area. I'm going to push on the bone, remove all those tiny bits of bone here to open the frontal sinus much more effectively. You can see all that dead tissue is going to come out anyways. So now I'm slowly opening up all the sinus areas, and I'm going to expose the skull base area from the very front to the very back part. And the entire skull base means the patient's brain. So I need to be really, really careful here. So whatever you see on the screen in the center right now where my instrument is, that is all brain up there. That is all brain, which is being protected by a layer of bone in between. So in the center where my machine is right now, that is all brain. You can see all the pus there, and just above that you can see that's the brain. That's the patient's brain seen from within the nose. All that dead tissue, bone is going to come out. All that tiny bits of pieces of bones is essential that it comes out. So there's some minimal bleeding there. You can see some fresh red bleed. That is an actual healthy sign. It means all that dead tissue is out. So if it starts bleeding a little active red, it means the normal tissue is visible now and all the dead tissue is out. So what I'm doing right now is I'm hammering on the maxillary sinus posterior wall, and I'm trying to go behind the sinus where another huge area is present called as the infratemporal fossa, and just above and beyond that area would be another part of the brain that is called as a temporal lobe, where actually this patient has an infection of. So you can see I'm taking that bone chip off behind the sinus, and what you can see behind, as soon as I open it, you can see everything is dead. It's all yellowish white, it's all fungus behind. Now normally this area would be full of blood vessels, full of muscles, and it would be appearing as flary red. But here you can see it's all dead. You can see it's all grayish white, yellowish, it's all dead material. So I'm going to suck all that out. Usually this area is full of blood, but then there's actually no blood because the fungus has caused the obstruction of the blood vessels and everything is just dying here. So it's essential for me to remove all that dead tissue here. Now exactly where you can see my instrument right now, you can see the pulsation. You can actually see the pulsation of the huge artery behind, the artery that supplies the brain as well, called as the internal carotid artery. That's the ICA. The thing which you can see is bulging out, which is pulsating right now, is the lateral pterygoid muscle. Now this muscle is responsible for the chewing movements, the opening and the closing of the mouth, the pterygoids. And that's the V2, that's the maxillary nerve. You can see the thick cord giving out branches in the area. This nerve is also dead, and as a result the patient has no sensation. So the muscles which is responsible for the chewing movements are seen in this compartment over here, and the muscles are also affected. So exactly where my ball probe, the instrument, is pointing out right now is the area of the temporal lobe of the brain which is affected of this patient. You can see all that cheesy white material. Exactly there is the brain behind. At your 3 o'clock on the screen right now will be your brain behind the bone, superior, above and outside at 3 o'clock. You can see all that white fungus affecting the area. Everything is dead here. So I'm going to remove all this dead tissue, make sure I have taken out the entire dead fungus out, and I'm going to later on pack this area with a lot of antifungal soak solution. Now, after having done all that, what I'm going to do right now is actually I'm going to open up the patient's eyeball, and to do so I need to remove the bone that covers the eyeball on the nasal surface. So what you can see, that's the eyeball there. The soft part is the eyeball where my instrument is right now. That's the floor of the eyeball here. That's the floor of the eyeball. And that's the eyeball which I can press right now. And that's the medial inner half of the eyeball. So yes, you can completely see the entire eyeball from within your nose. And that's the bone. You can see it's how infected the bone is. It's all dead. And that's the soft tissue of the eyeball there. You can actually press on the eyeball the way I'm doing right now. So before you open up the eyeball, you make sure that the entire bony covering of the eyeball is completely out. That's the posterior part of the eyeball. That's the floor of the eyeball. Little bit of bone I'm going to take off from the floor as well, because the main fungus on this patient, as per the MRI scan, is in the medial, that is the inner and the lower half of the eyeball. It's completely gone. The patient's eyeball will have to be removed later on as well. You can see that's the brain up there, and that's the eyeball at your 3 o'clock. That's the complete picture of the eyeball, completely exposed right in front of you right there. That's the entire eyeball right there. See, that's the forehead, that's the left eye, and that's the left eye seen from within the nose. So I'm going to take 2 incisions, one in the lower part. You can see I'm cutting that layer. This layer is basically the protective layer of the eyeball, called as periorbital fascia. That's the upper half incision, and then I'm going to connect the 2 incisions, and I'm going to start sucking out all the dead tissue from within the eyeball. So that's the machine, and I'm sucking all that dead tissue. Now normally, if you in a normal situation open up the eyeball exactly in this way, the moment you take the incision, a bright yellow healthy fat is gonna pop out. That's all the pus and the fungus you can see. So normal situation in a healthy individual, yellowish bright fat is gonna pop out once you take the incision. But as you can see here, it's all yellowish, dead, white, black material coming out. So everything is dead. Soon I'm going to show you the muscle and the optic nerve as well. You can see it's everything yellowish black. The fat is all gone, necrosed. So you can see something in the center where my instrument is right now. Something like a cord-like structure, pink in color, purplish pink. That is the optic nerve there between the 2 muscles. That is the medial rectus and the inferior rectus. So I've opened up the eyeball. I've taken out all the fungus from within the eyeball. Now, this patient does not have any vision, so I'm just going to wait for 7 to 10 days from this surgery. If the patient has any kind of improvement in the eyeball on the left side, it's good. I'll keep an observation on the patient. But if the patient does not have any improvement, I'm going to call the ophthalm, that is the eye surgeon. And you can see I'm pressing the eye from outside and the eye is moving from inside. So I'm going to call the ophthalm surgeon, and I'm going to ask him or her to take the eyeball completely out of the socket, so the patient will not be having any left eye anymore. You can see all that dead tissue. That's the optic nerve where my instrument is right now, the thick cord-like structure. Normally the optic nerve would appear as yellowish white or white in color, but here you can see it's pinkish, violet, purplish. That's the optic nerve which I'm pulling on right now. That's the optic nerve going behind into the brain from the eyeball. Now what you can see me doing here right now is this is a self-absorbing Abgel which is soaked in the amphotericin, which is the antifungal, potent antifungal. So this amphotericin B powder turned into liquid appears to be as yellow, and I'm going to take small to medium sized pieces of ab gel. I'm going to soak it in the amphotericin B paste, and as you can see, I'm going to put that entirely within the sinus and the nasal cavity and along the skull base as well, so that the infection has a good response, and whatever dead tissue I've taken out and whatever healthy tissue I've exposed, I'm going to place these ab gel on that healthy tissue as much as I can, and hope for the improvement happening inside. Also, along with this, I'll be starting the patient on IV injection, same name, amphotericin B, but the liposomal variant of the amphotericin B, because if you use what you can see on the screen right now is the conventional form, but you got to use the liposomal form if you're using the IV injection to prevent any kind of kidney damage. Then later on, you can see I'm going to pack the entire nasal cavity with this long gauze soaked with antibiotic and antifungal solution, so that this pack will be removed after 3 to 5 days. Similarly, I'm going to pack this on the patient's right side as well, just to be safe. That's the patient's right side with a normal healthy bleeding, which you can see right here. So this is how the surgery for the active mucormycosis / aspergillosis aggressive form of fungal infection is to be done to save the patient's life.